Today I am discussing why C-section moms would still benefit from physical therapy and specifically pelvic physical therapy. So it's a common misconception that just because we have had a cesarean delivery that we do not need pelvic physical therapy, and I am just here to tell you that is not true, that all mothers, regardless of what delivery method, whether that be vaginal versus cesarean, whether it be, an unmedicated or an induction, all sorts of deliveries need to see a pelvic PT. And so for all of you C-section moms, I'm here to tell you throw a few numbers at you, throw a few stats at you. So 21% of all deliveries worldwide, so 1 in 5 deliveries, according to the World Health Organization, are C-sections. They estimate that this number is going to increase by 2030 to about 29%. And local here to the United States, 39% of all deliveries are C-section as well. So it's a huge portion of all deliveries that are happening are C-sections, and that's totally okay. And there for numbers of reasons that C-sections occur. But regardless, after your delivery, you still are eligible for pelvic PT, and you should make that a priority to be seen and evaluated by a pelvic physical therapist. And here's why. So you just spent 9 months carrying a baby, and so therefore your pelvic floor was stressed and was used for 9 months to carry that growing baby as your uterus expands, as that puts a lot of that added pressure here on the pelvic floor muscles, that those muscles were still kind of weathered and worn throughout your pregnancy. So you still are at risk for urinary leakage, so pain with sex, any kind of pelvic pain as well can still occur after your C-section. As well as a C-section is a major abdominal surgery, and it oftentimes isn't seen like that, right? It's overshadowed partially by the fact that you are a new mom and you have this new baby to take care of, and so really the recovery of your C-section is kind of put in the back burner, and we are here to support you through that recovery. So like I said, it's a major abdominal surgery. Whenever we have a C-section, we are opening up through the skin, through our muscles, through that fascia, even through that organ to get our little one out of that uterus. And so therefore that can cause a lot of pain, discomfort. We want to work on our C-section scar. A lot of you C-section mamas might know that you have some of that numbing, some discomfort there, some decreased mobility and pulling of that C-section scar. And so just like any scar on the body after, a shoulder or a knee surgery, we want to get that scar moving. We want to loosen up that tissue to help it not be as painful or as restricted. We also want to work on our abdominal wall and how those abdominal muscles are firing. Again, just like any vaginal delivery, you're still at risk for a diastasis, as well as even more for some dysfunction in those abdominal walls and those abdominal muscles, just because there was an incision through those muscles too. So we want to get your core firing properly, not only just to get back into exercise, get back into getting strong, as well as cosmetically, just our body. We also want our core to be functioning to decrease any sort of low back pain, as well as hip pain, and all of that to keep us nice and engaged and helping through that recovery. Other things that we can help you with, again, is just still, like I said, that posture, that body mechanics training, right? How to find those comfortable positions when you're lifting your little one. If you have a toddler at home and you have that C-section, how can you safely lift your little ones, your babies, and do housework? As well as getting to that point of returning to exercise, right? Exercise might be a little bit more difficult after your C-section, just so that you can, again, regain that core control, return to the exercise that you love, as well as, if you want to be a runner, if you want to be a swimmer, if you're a yogi, anything, we want to help you return in a safe way. Again, helping you with that pain management, working on our posture, our alignment, our muscle strength, our flexibility, all of those things come together. And at the end of the day, we want to help your pelvic floor, we want to help your core, we want to help you and guide you in the right direction for how you can safely and effectively recover after your C-section. Just to summarize here again, you have had significant stress on the pelvic floor for the last 9 months carrying babies, so you still want that pelvic floor to be examined, as well as that a major abdominal surgery. We want to see how that C-section scar is healing and how those muscles around that incision are working and firing to help you be the most effective and efficient new mom you can be. If you have any more specific questions and you feel like you are a C-section mom and you didn't realize that pelvic PT could help you, don't hesitate to always give us a call or check us out at Legacy Physical Therapy. We would be more than happy to talk with you about what you're experiencing, help you with what you've been going through, and also check out how you're moving and grooving. So